35 total positive cases for COVID-19 so far, 5,333. Total number of patients in hospital at this time, 80. At step down, 51. At quarantine facilities, 369. And the total persons in home self-isolation, 1,346. To break the figures down a little further, in terms of hospital, at the Couva Hospital and Multi-Training Facility, 59 persons remain, 5 in ICU, 10 in the high dependency unit. At Cora, 16 persons. Arima Hospital, 2 persons, 1 in ICU. Scarborough Regional Hospital at the Fort, 3, and none at Signal Hill at this time. In terms of our step-down facilities transition, there are 51 persons. At the Claxton Bay facility, 26 individuals remain. UWI Bay campus, 10, and in Tobago there are 15. With regards to our quarantine facilities, a total of 369. At the Chancellor Hotel, 27. Cascadia Hotel, 19. Homo Football, 36. Regent Star, 64. Paria Suites, 70. Davy Halls, 33. UWI Freedom Hall, 33. And UWI Canada Hall, 87. So I would have presented some data as it relates to acute viral illness and influenza with some graphs earlier on in the year. So I just want to represent that data with where we stand as of last week, Friday, to show 4 graphs that will give you some images. If we could go to the previous slide first, acute viral illness. Okay, so we start with acute viral illness. Basically, it's a broad category in terms of our surveillance system. It picks up any viral-like illness, no matter how mild it is. So we see going along, week 12 comes at the end of March. So if you start on the left of your graph, the green channel, they listed it as being successful or well within the containment zone. Security as yellow, meaning that we have to put measures in place to try to curtail the epidemic. Alarm goes into the orange, and then beyond that, we enter epidemic phases. So how we get the green, the yellow, the orange, and the red bits, or the pink bits, is showing up a little pink on the screen, is by comparing data over the past 5 years and trends thereof. So if we start on the left, we're looking at the total number of cases of acute viral illness for Trinidad and Tobago. We see January to March, more or less. We have consistent into the security zone, going a little bit above, coming to the end of March, into the orange zone, and going very close to the alarm zone. As you know, at the end of March 23rd, I believe, we closed our borders, and we had a number of public health measures put in place. So we saw a significant decrease in the number of viral illnesses occurring within the space of about 3 weeks, and maintaining a very low level from weeks 15 all the way to week 29. At week 29, which represents end of July thereabouts, we see there's a sharp upsurge in viral illnesses going into the epidemic alarm zone, peaking somewhere between August, early part of September, and then beginning to come back down. Week 42 is really roughly the end of last week. So we see that graph going all the way up in August and September, and back down again into the green control zone. We are at a very low level at this point in terms of acute viral illness. Next slide. So the next slide shows a similar pattern with different colors, but we see it related to influenza. Just to remind the public, the influenza season begins in October of any given year in the Northern Hemisphere and ends in May. So we see there's a small increase, not very significant. We're still within the green zone, well within the green zone for the first 13, 14 weeks of the year. Then it begins to decrease subsequently, which we are going into the end of the influenza season. And last year we would have vaccinated approximately 120,000 persons with the influenza virus. And of course that will lend itself to decrease influenza in any country. We see after that there's a significant decline, and we haven't come out of, there's been no increase since week 16. So it's maintained steady. We would have gone into the first part of the season for this year, 2020-21, starting in October. No significant increases as of this time. Next slide. So as we know, COVID-19, you can see gastrointestinal side effects. You can see diarrhea, vomiting. Pediatric physician, Dr. Joan Paul, would have gone into some of the details related to abnormal presentations in children, So this would be a graph for gastroenteritis less than 5. Again, we see in the early parts of the year, which is much higher than normal, January, February, we would have had a spike in the number of gastroenteritis cases, and then that subsequently declined. About week 13, we went into a sort of plateau level, and all the way down until week 41, we have a very, very low level of gastroenteritis in the country. Last slide. So the last slide gives you an idea of gastroenteritis beyond 5, a similar pattern to gastroenteritis less than 5, but I think it is a little further on. It goes beyond into weeks 13, 14, and it remains a little bit higher than the childhood gastroenteritis, but staying well within the success or the endemic zone. And at week 40, 41, we are at the lowest level so far. Candice, that's my clinical update for this morning.
Thank you very much, CMO. And we move from the epidemiological information to a presentation from Dr. St. Bernard. She will provide simple tips and steps that you can take to ensure that you adhere to the new normal guidelines. We go to Dr. St. Bernard.
Thank you, Ms. Alcantara. Good morning, Dr. Roshan Parasram, Chief Medical Officer of Health. Chief Medical Officer. Good morning, Dr. Abdul Hamid, General Manager, Primary Care Services of the North Central Regional Health Authority. Good morning again, Ms. Alcantara, Manager, Corporate Communications at the Ministry. Good morning to the media, and good morning to the viewing and listening public. Today, I have been invited to give a short talk on everyday tips to align to COVID-19 guidelines. So if we look at the first slide, we are looking at the question, what does 6 feet of physical distance actually look like? We keep talking about physical distancing, but what does it look like? Because many people I have observed think they are distancing when they are in fact pretty close. So if you look at the first image, you would see that approximately the width of a standard car is actually what 6 feet looks like. As well, on the other slide, you would see it also can look like 2 arms lengths of an adult. So basically, if you're with someone, you stretch out your arm, they stretch out theirs, and that's the distance that you're looking at. And you need to ensure that this is the distance between you and others in different scenarios. So I would choose very specific scenarios to look at. So public transport. If you are entering into a taxi or into a bus or a maxi, you need to ensure that there is adequate physical distance between you and others. That is down to you. You can't leave it up to, the conductor of the maxi or so. You have to ensure that there is an adequate distance between you and the person next to you. What about eating with co-workers? I see this as a very, very high risk for transmission of COVID because, of course, when you are eating, you are unable to wear your mask. When you are drinking, you are unable to wear your mask. So these are scenarios when you get together with your people at work, your co-workers, to eat. You need to ensure that you are adhering to the physical distance. At the grocery and the market, sometimes when you are lining up or just as you were reaching for an item, someone else may be reaching for that same item. You want to give that person space or they need to give you space. So you need to, be looking around and constantly ensuring that there is, in fact, a 6 feet distance between you and the other person. What about collecting goods? Some of us continue to order things online and then the person would come to deliver to your door. When you go to collect, you have to find a way to ensure physical distancing. And of course, when people come to your home, like servicemen, the plumber, has come to fix a pipe, don't get in too close. Both of you might be wanting to look at the tap to see what's the issue. Ensure physical distancing. So keep on keeping your distance. Next slide. Well, I mentioned the grocery store. So if we could look at that slide with the grocery store image. You want to try to go to the grocery when there are fewer people there. By extension, this applies as well to the bank and other places where many people are expected to gather. So, you have to know your bank, you have to know your grocery, your shop, your parlor. What are the times that people are less likely to go? Even by day, you may know that Saturday afternoon, many people aren't going, or maybe Sunday lunchtime or Sunday, just before they close. Just kind of think about when is the best time to go such that there aren't crowds expected. Try to avoid situations where it would be difficult to maintain physical distancing. Keep on keeping your distance. For the next slide, we're going to look at what does it mean when we talk about cleaning and what are the things we need to consider in terms of regular tips. So first of all, we've said before, when you are cleaning, you're cleaning with 1/3 cup of bleach mixed with 1 gallon of water. But how do you actually operationalize that? Or how does that actually work? Does everyone have a gallon of water with the bleach already mixed? Easy ways to keep cleaning is to have smaller bottles with the bleach and water mixture on hand. So after you've done the big mix, pour it into smaller bottles, and maybe you can have in each bathroom. Maybe you can keep a small one in your vehicle. Maybe you can even keep a small one in your handbag or work bag. And as we're talking about cleaning, what about if there is inadequate sanitizing of your workspace? You can practice doing this for yourself every day. So walk with your little bottle and sanitize your surface, your keyboard, where it is you know you are going to touch. Label the bottle. So if you are pouring into other bottles, please be sure to label the bottle to ensure no one thinks it's drinking water. And of course, please do not use water bottles. You know, the brand name water bottles. Don't put the mixture of bleach and water for there to be hazards introduced into your home. Next slide, we're going to look at the issue now of the hand sanitizing that we keep talking about. How can we be more practical, and what are the tips I can give for that? Keep a bottle of hand sanitizer with you everywhere you go. Keep one in the car, one in your pocket, one in your desk, right? Remember to sanitize every time you change an interaction. So for example, every time you return to your vehicle, you need to sanitize your hands again. As you leave the taxi or the bus and you're starting to walk home, sanitize again because you would have touched surfaces. Just finish paying for a transaction. You would have handled cash that the cashier may have given you, or you may have touched a links machine when you did your credit card or links transaction. Sanitize after every one of those. So that's why it would help if you have a bottle of hand sanitizer everywhere you go. Small ones. You don't need to have large ones. Next slide. How can I remember to always take my mask, or how can I remember to always have my mask with me? Keep your mask where you keep your keys. What about that? Hang clean ones on the hooks, or you can have a mask station near to where you keep your purse, wallet, or keys. So some of us actually would have our masks, clean ones that have been washed, laundered, hanging right where you have your keys. So as you grab your keys, you grab your mask. And I'm sure for some of you, it cannot be myself alone. You literally jumped in the car and then looked around and realized, where is my mask? You're not going to be allowed to go anywhere without the mask. Speaking of purse and wallet, you can also keep disposable masks protected in plastic or box, or in a box, in your wallet, purse, bag, or in your car. So keep a stash basically anywhere that you can think of. And to ease the discomfort of mask wearing, you can use something called ear protectors to reduce pressure on the back of the ears. Because sometimes when we have the ones with the hooks, sometimes that's why people keep taking off the mask, because it's actually hurting your ears. And as well, I want to speak about increasing tolerance to wearing the mask. And the irony is, you need to wear the mask as often as possible, because the more often you wear your mask, the more you're going to be able to tolerate the restricted feeling of the mask. And remember as well, when workmen service providers come, you need to be wearing your mask. So not just the physical distancing. When people come to your home, please remember to wear your mask. And the last slide is looking at wearing the mask over your nose and mouth. I know we've said it, ad nauseum, but I say it yet again. We need to. And why do we need to wear the mask properly? Because you don't want to risk a loved one's life, and you don't want to risk your life. So, in terms of risking a loved one's life, you don't know if the person you are with has COVID. And then when you are now going to visit your elderly loved one later, as we say granny gets called a lot, you may end up putting their life at risk based on the fact that you had an earlier interaction with someone who had COVID and you did not know. And then you don't want to risk your own life, because remember, CMO has alluded to this in the past in previous media conferences. There are some of us who do not know we have a chronic disease, and therefore if you don't know, you need to protect yourself from contracting COVID by wearing the mask over your nose and mouth. So keep on keeping your distance. Have your hand sanitizer on hand everywhere you go. Clean surfaces often. Wear your mask over your nose and mouth. Thank you.
Thank you very much, Dr. St. Bernard, for those tips that are very easy to follow. I think I'll take some of them myself. And we go to Dr. Hamid now, who will give some insight into the telemedicine initiative that's happening at the North Central Regional Health Authority.
Hi, good morning, CMO Dr. Roshan Parasram. Good morning, CMOH of Caroni North, Caroni Dr. Janine St. Bernard, members of the media and the listening public. So I come here today to give some pretty good news about our innovative sides of the healthcare system. And can we go to the first slide, please? And this is called the Telemedicine Initiative. And basically, telemedicine is a relatively new concept in the field of medicine. First slide, second slide. It's, as you could say, probably revolutionary in terms of it's something that's born out of necessity or need. It's the exchange of medical information from one location to the other using electronic communication. It allows physicians to treat patients whenever needed and wherever the patient is. And this is important for us here in Trinidad and Tobago, especially for healthcare access, enhanced healthcare access for patients. Next slide. So very important. So telemedicine, what it does, it offers an opportunity to improve our health systems in three main areas, which is healthcare delivery, access, and efficiency. And that's an important one, efficiency. So during a pandemic, as we have been hearing over and over again, there are vulnerable sectors of our communities. And this is because of the threats that in these key areas. They include the elderly, those with comorbid conditions, such as those with NCDs, such as hypertension and diabetes. And we have seen again and again that when we have our daily mortality updates, they are always quoted that having this person died from, has more than one comorbid conditions. And these persons are also the highest risk of poor outcomes if they develop COVID-19. Next slide. So what are the benefits of the telemedicine programs? So it's a reduced healthcare costs. It's enhanced prevention of complications, and which in Trinidad and Tobago, one of our biggest problems is access to medicines and compliance. It's actually much more convenient and accessible patient care, and an extended specialist and referring physician access, increased patient engagement, and better patient quality and personalized care. And we actually have a more extended patient-physician interaction in a relaxed home environment rather than a busy clinic. Next slide. What are some of the benefits for the patients? So we have a markedly reduced risk of contracted COVID-19, no use of public transport, less transportation time and costs, less time away from work for work in public, interaction with their regular primary care physician, and that's an important caveat that I'll explain later, because you have a personal link, a personal touch with the healthcare system. It's an increased opportunity for reviews by the doctor without the challenges of coming to the healthcare facility. Increased opportunities to self-monitor, and very, very flexible appointment times. So basically, patients don't need to come to have a specific appointment time. Any time of the day, they could possibly contact their physician, and the physician will talk to them. Next slide, please. What are the benefits for healthcare staff? So some of them are reduced risk of contracting COVID-19, less crowding of clinics, more efficient visits, and ability to obtain real-time specialist advice. Next slide, please. Right, so let's get into this, the telemedicine, North Central NCRHA primary care services. Basically, when the pandemic started, it was quickly realized in March 2020 that we had a situation whereby we could not have clinics running. It was a national lockdown. Patients couldn't get medications. And what we decided to do to enhance that delivery of medicines or delivery of care to patients, this is where the primary care telemedicine program was born. So primary care doctors, how it works, the primary care doctors will call your patients prior to the clinic. Primary care doctors will call patients prior to their clinic. Clinic dates to identify those with uncontrolled diabetes and compromised immune systems. And this interaction is a personal interaction. It's where the primary care physician would then speak to the patient in their own comfort zone, make them very comfortable, allow them to, tell them what are their challenges, what are the issues, give them counseling. Because one of the things that we discovered early on in the pandemic, because of the lockdowns and the persons were not able to come outside. There are a lot of issues that we picked up that allowed us to do a lot of counseling on the phone. So extensive counseling was done, including discussing our scheduled lab tests, discussing the parameters, discussing how they were able to maybe even come in to get reassessed, even increasing the medications or decreasing medications, lifestyle changes, things that could have not been done in a busy clinic setting was being able to be done in a telemedicine format. How we do the prescriptions. So renewal of prescriptions were done automatically. And it was one of the first things we were very, very strong with. In terms of persons, we advise persons to let their relatives come or a designated person to come and pick up medications at our healthcare facilities. And to make it even more convenient, the medications were prepackaged. So the waiting times, it was just a come in, pick up, and go. If it was discovered that a patient needed a further assessment, what we would have done is what we were doing and are doing currently is bringing in the patients for an assessment, blood tests, just to make sure that patient does not end up back in the hospital with a decompensated comorbid condition. Also, we had many opportunities or points when we spoke to patients and we discovered that they have symptoms of deterioration and that we would have then called out the ambulance services to go and assess the patient and bring them into the hospital setting. Next slide. In the last 5 weeks alone in NCRHA primary care, we have done at least 5,000 patients via the telemedicine platform. We actually observed something that we never saw before, which was an increased compliance on persons picking up medications. So generally in our national setting, we have at least 10% of persons not collecting medicines, not taking the medicines, and these persons will end up back in the hospitals. We've seen almost 100% of persons picking up medications in this program. Thus, we have a more motivated, self-aware patient and with a well-controlled patient. Patients, and this is where it gets very, very good for the healthcare system, in that patients have publicly expressed very high appreciation for this proactive initiative, in that it's literally having the healthcare system in your house, inside your house, giving you advice on the phone. And it's very, very public friendly and very, very beneficial to the entire healthcare system, both ways, in that you cloister the persons with chronic diseases, you prevent them from deteriorating, and you prevent them from coming into the hospitals for deterioration. Next slide. So the future. So the telemedicine is becoming a part of the landscape of the healthcare system in Trinidad and Tobago. It addresses the needs of this important group of patients. If ignored, of course, the chronic situation will continue to deteriorate. Monitoring and action can still occur to prevent complications while movement is restricted by COVID-19. And it creates a new channel to keep our communication with our patients open so that we can deliver much needed medical care and the high level of monitoring and support they need to reassure them our commitment to their care. Next. The future. And in the future, we're looking at, and this is rapid prototyping, in the future, what we're looking at is greater self-monitoring of patients. So there's no need for them to step out, get a blood pressure done, and so on. It could be done at home. Basically, we bring in medicine at your doorstep, and expansion of the telemedicine program can utilize text messaging, electronic reminders, and video conferencing. And I thank you very much.
Thank you very much, Dr. Hamid. I really appreciate that update on that development in public health. And we go now into the question and answer segment of this conference. Media representatives, please indicate your name and the media house that you represent before posing your questions. And we begin with questions from C and C3.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. My two questions are to the Chief Medical Officer, Dr. Roshan Parasram. So firstly, where are we at right now in terms of spread of COVID-19, especially when contrasted to the previous 2 weeks? And I ask this as we come to nearing the end of this period of restrictions. And secondly, we understand that the tuberculosis ward in Cora Hospital is filled. Now, I want to get your comments on that. Is this true? How many persons can this ward accommodate? And are we seeing what appears to be an outbreak of tuberculosis locally?
Okay, so in terms of your first question, I would have said, I believe on Monday, that we're hovering somewhere around 30 per day in terms of number of cases. That is based on the week prior. So that's not based on this week's data as yet. Normally what we do is we do a tally on and about Friday or Saturday for the previous week, and we give you a weekly average. So that should be able to be presented on Saturday as well, so that we can see if there's a decline. But this is last week's average of about 30 to 32 per day. The week prior to that, we had, if you recall, somewhere around 52 to 53 cases. So there has been a reduction. We are hoping to see that trend continuing in the rest of the week, and we'll have a better idea on Saturday or thereabouts what happens during this particular week. With regards to the TB ward, I am not aware of an outbreak of TB greater than the normal level of endemic TB that we have in the country. I can check in with the North Central Regional Health Authority Thoracic Medical Director, who is Dr. Trotman, to find out if there's any truth to that story, and we can look into the TB wards. There are multiple wards that Cora has for the treatment of tuberculosis, and I'm not aware that any of them are filled to capacity, but we will check into North Central to get some more details.
Thank you very much, CMO. And we go to 98.1, please. Hi, Mr. Cummings. Just check on your volume again. I see that you're speaking. Mr. Cummings? Sorry, we're not hearing you, Mr. Cummings. Just check on your volume for us, please. And I think you're right. Good. We're hearing you now. Wonderful. Good morning.
Yes, good morning to you, Ms. Alcantara, and the doctors there, CMO, and members of the panel. Stephen Cummings, 98.1 FM. My two questions are really for Dr. Parasram, and the first being somewhat of a technical question, and here's hoping that it does not impair a fair response. There are reports of some persons who continue to display mild, persistent symptoms for long periods after being treated. And I did ask a question earlier about what is considered by some experts to be long COVID. Is it possible to measure levels of body immunity in relation to the virus when you have different immune responses in instances of mild, moderate to severe cases? And what could be the longevity status of such immunity? For example, how long is it likely to last? And second question, Dr. Parasram, we are still learning about animal hosts and virus transmissibility to humans. Having said that, in reference to the COVID-19 public health regulations, what are the preferred or should be the preferred guidelines for conveying of domesticated animals in private vehicles? I've seen instances where animals are carried or transported unmuzzled, not only in private cars, but even in public places. Are there any guidelines pointing to how transportation of such domesticated animals should be treated with? Thank you.
Okay, so in terms of, I know we had a discussion last week, it was on long COVID. It would have been defined as the persistence of symptoms, I believe, more than 3 weeks in duration. We have seen it in Trinidad. We have seen a number of people that have presented, so much so that a clinic has been set up within North Central to deal with that particular entity, be able to offer physiotherapy and a multidisciplinary support for those individuals who are seeing signs and symptoms persisting, especially most commonly shortness of breath and fatigue for long periods of time. In terms of measuring your body's immunity, I know studies have been done in different parts of the world to see if persons, one, develop immunity to this particular disease, and how long does that immunity last. I think we are a little short in the way the disease is with us only about 9 months, 10 months, to say what will be the long-term effect of, or how long will these antibodies last, and will they be neutralizing in effect. So I think we're a little early on in the progression of the illness to say with any level of certainty whether antibodies will persist for a significant length of time. As it relates to animal host, all that we know for certain is that some species, particularly mammals, are able to at least be infected with this particular virus. There has been a number of instances where sampling has been done of mammals and picked up as positive, including dogs, and including, I think, most noteworthy in New York, there was infection in the large cats at the zoo in that particular area. But having said that, the guidelines will definitely have to come from the Chief Veterinary Officer at the Ministry of Agriculture as it relates to transport of animals within the country and even importation.
Thank you very much. And we go to Newsday for the 2 brief questions, please.
Hi, good morning all. Shane Zuberville from the Newsday newspaper here. I have 2 really quick questions for the CMO, Dr. Parasram, and that has to do on the issue of testing. I read on the CDC's website earlier today that aside from the novel coronavirus, there were 4 strains of the coronavirus, 2 alpha and 2 beta. The question I have is, the current swab test we have in TNT, does that accurately distinguish between the various types of the coronavirus? And the second question related to that is, does the detection of any of these earlier types, either alpha or beta, put someone at greater risk of contracting the COVID-19 or testing positive for COVID-19?
Okay. So in terms of your types, as far as I know, there are about 6 types that have been recognized in the world. Subtypes. L type has been the first type out of Wuhan, China. What you're asking about the nasopharyngeal swab is the preferred method of sampling to do a PCR test. So the sampling type will be the same to discern whether you're dealing with L type or any other type of this virus. So the University of the West Indies is actually doing a study now to determine what types of subtypes of viruses we have in Trinidad. But that has been done in other parts of the world to show that there's subtle variances in the subtypes. However, it has not been shown, at least at this point, that these viruses and the subtypes have significant differences in terms of the way they are transmitted or their infectivity or the clinical outcomes with different strains to any significant level. So they seem to be minor mutations to the most part. Candice?
Thank you. And TTT, we're ready for you now, please.
Hi, good morning. Sonal Lala from TTT News. CMO, on Monday morning, I would have passed a bus carrying it was a busload of people. The driver was wearing a hazmat suit and they were heading towards Grandi area. I actually passed them on the Valencia stretch. Now, I know a couple of weeks ago, the Campo Balandra and Brooklyn facilities were decommissioned. So could you say where these persons were being taken to? Has these facilities been recommissioned? I'm not sure if you can speak to that. Thanks.
Okay, so at this point, the Balandra facility remains decommissioned. So I can't say where those persons would have been going to, who they would have been transporting, to be honest. But there are instances where we transport persons for different reasons to different quarantine facilities, step-down facilities. I can't say with that particular instance where that group of individuals would have been going.
Thank you. AZP News, we are ready for you now.
Hi, good morning. Priya Bihari, AZPnews.com. Dr. Bernard, some people say that they cannot take the scent of bleach. Do you recommend any other alternatives? And to the CMO, there seems to be some conflicting information now about whether asymptomatic people do spread the COVID-19. Can you just give us an idea what is the ministry's take on that? Thank you.
Hi, thank you for your question, AZP News. I am not aware of other suitable alternatives as per recommendations from WHO and CDC for adequate cleaning. What I would suggest is for persons who cannot tolerate the scent, perhaps what they can do is have someone else clean and they protect themselves. And of course, there is always the option of the alcohol. So alcohol-based hand sanitizers can also be used to sanitize a surface if it is you are unable to tolerate bleach. I hope that answers your question.
Yeah, so prior, I think we're getting at the question where WHO had announced a couple of days ago that persons who are asymptomatic, although positive, do not really contribute greatly to the spread of the disease. So basically, that is where we're at in terms of WHO doing some analysis of the research that has come from different parts of the world, I believe Singapore and a few other countries, that suggests when they look at the contact tracing chain that asymptomatic persons, although positive, do not contribute to any great extent to the way that this disease is spread. And it gives us some more heavily reliance on what we say and what we keep saying about people being ill and staying at home. So more so now, you can actually tell the people who actually have symptoms are the ones that are going to propagate this virus and spread it to your colleagues, spread it to your family, spread it to your friends. So more so, we are cognizant of the fact that our testing strategy has been aligned to pick up those persons with symptoms predominantly throughout, and which has been the WHO strategy and the recommendations from the beginning. So based on this new development from WHO, we will continue with our testing strategy, but we are asking again, persons who are ill and who have been driving the propagation of this disease forward, once you are ill, please stay at home. If you are contact of a case, stay at home.
Thank you, CMO, for reinforcing that recommendation. I-95, Mr. Turner, we're ready for your questions now, please.
Yes, good morning to you, Candace. Morning to everyone else there. CMO, just to go back to Shane's question where you mentioned a study that's being done by UE. Any idea as to how soon those results will be made public? And secondly, there is something that, well, I would call it pandemic fatigue, which is becoming more and more prevalent, especially for nationals stuck abroad. For them, the repatriation process is still not moving as fast as they would like. And some of them are suggesting that they be allowed to return home once they have a negative PCR test. That's one of their ways of speeding up the process. Is that something that you are likely to look at in terms of a favorable outcome?
Okay, so with regards to the UE study, last I reached out to the University of the West Indies through Professor Carrington. She had indicated that they were putting things in place to be able to begin the testing. The sample collection is through the Caribbean Public Health Agency, and we would be collecting samples for all of the Caribbean for both phase 1 and phase 2 to see what is happening throughout in terms of different subtypes, if we have different subtypes. But she said she hasn't begun testing those samples as yet. They're in the process of putting their lab together to be able to do so, and will update the ministry on their progress as soon as it comes to mind. Just to, if you could just quickly go past your second question to clarify for me, Mr. Turner. Just run over your second question quickly.
And as we wait for the volume to come up, Mr. Turner asks about pandemic fatigue and strategies to speed up repatriation for persons with negative COVID tests. Yes, we're hearing you now, Mr. Turner.
Yeah, so, right.
Yeah, so it had to do with having them return home once they have a negative PCR test, rather than having to simply wait on the current process that's taking place now, which is not moving as quickly as they would like. So they want to know if they can return home once they're able to produce a negative PCR test. Of course, this would also entail some reopening of the borders as well, I suppose.
So basically what we have is two national policies. We have a policy that is for low-risk countries. Low-risk countries are countries that actually have no spread or sporadic spread as classified by the World Health Organization. For those countries, what we are asking for is a PCR test 72 hours prior to coming into Trinidad and Tobago. Once you have the PCR negative test, you have no signs and symptoms upon entry, you'll be allowed to quarantine at home for 14 days. In terms of our classification from moderate to high risk countries, those are the ones that have cluster spread or community spread. And as we raise the issue of different strains, we are trying to guard against different strains of this virus coming into the country as well. As we have noted in the United States, the UK, Europe, and other parts of the world, there is a recent upsurge in number of cases that have occurred. We were looking very closely at the international community to see if we could have eased on the moderate to high risk countries in terms of relaxing that and letting people quarantine at home. But with the recent upsurge in cases, it puts that possibility a little further down in terms of us going that way. We noted, and I said on air last week, that out of 67 people that came back from US, 7 of them came back as positive when we did the day 1 or day 2 swabs. And we have seen, even in as recent as yesterday, someone coming in from Barbados and having a day 7 swab after getting a day 1 negative swab and turning out positive. So we're still getting positives from the repatriated individuals. And we are holding our quarantine orders for now, 7 days for moderate to high risk in a state facility, followed by 4 days at home.
Thank you, CMO. And we go to Express newspaper, please.
Good morning, Kim Bodram from the Express. CMO, I just want to follow up. I see Mr. Turner raised an issue on repatriation. So to ask you, and without implying at all any lack of concern on the part of authorities, we saw an unfortunate incident of an elderly gentleman passing away abroad while waiting to come back home. So I want to ask, when something like this happens, obviously you would be concerned as someone, health and life being your primary cause. But so I want to know, are you triggered, or is your agency triggered by incidents like that to want to not micromanage, but recommend further that the other authorities look at, trying to streamline who really needs to get in here as quickly as possible? I hope that's the clearest way I could have put that. And also my second question, maybe Dr. Bernard, you raised certain, little details about how we maintain this new normal. So someone asked recently, they were on their way to see their elderly father, and on leaving work, they were hugged very tightly, very suddenly by a coworker, and she did not have time to go change her clothes, etc. So the question was, how do you sanitize your clothes when something like that has happened? Do you wipe it down with a sanitizer? Do you need to now arm yourself, for instance, with a spray bottle of alcohol? These just little details like this to help us maintain this new normal. Thank you.
So, we are in the middle of a pandemic, and there has been loss of lives. We have lost more than 1 million lives worldwide. There are some consequences of the pandemic which we have no control over. There have been persons that have requested having even human remains come back into the country in the early part of this epidemic and to leave Trinidad and go to other territories who have not been allowed to do so. We have had funerals take place in Trinidad with 5 persons and less. And these, of course, cause the persons, their loved ones, to have significant distress. But we are doing all of this in light of containing spread and living in a pandemic. Having said that, the Ministry of National Security and the Honorable Minister of National Security has been on this program and others saying what his criteria has been. And we leave that decision up to the Minister and the Ministry of National Security to determine who comes into Trinidad and who is granted an exemption.
And we go to Dr. St. Bernard.
Hi. Thank you for your question. That is such a relevant question. I would suggest, well, in terms of sanitizing your clothing, what is established and known to work is, just like we would recommend when you get home, generally from interacting with the public, you immediately have those clothes put in the laundry and change even before you engage with your regular relatives at home who may not even be high risk. So I know you mentioned the issue of time being a factor, but I think if we have to balance time versus protecting our loved ones, especially those who may be at risk or who have comorbidities, I think it is wise to, if you can, go home at first to change and then go to make the visit. if there's a possibility to go to maybe some public place to change before going to interact with your loved one. I do not recommend, and we don't have recommendations or guidelines that suggest spraying down, yourself, because we don't even spray people anymore. The most they may do is footwear in terms of the guidelines. So I would suggest changing first before going and putting your loved one at risk. Hope that answers the question.
Thank you. And I think CMO had a response to an earlier question.
Yeah. So I believe you were asking if there was an outbreak of TB. I got some information from Dr. Trotman, who indicated for the total number of cases for 2019, we had 242 persons with TB in this country. Total cases thus far this year, 196. If I can go month to month, June 19, we had 2019, there were 12 persons. June 20, 30. July 37 in 2019, 26 in July of this year. So there's more or less the same sort of distribution from last year to this year. The numbers remain less than last year so far, with about a month and a half left, 2 months for the year to be completed. So there's no point source epidemic, according to the medical director from CORA.
Thank you. And we go now to Tobago, Channel 5, please.
Hi, good morning. My question is in regards to security for step-down facilities. We have been getting some information that one of step-down facilities here, persons are passing items through the fence, and there are persons inside the facility being observed from the outside, mingling with each other, playing cards and that sort of thing. So I've just want to get an idea of what is the security protocols for step-down facilities.
Okay, so from the start of the epidemic, we had engaged in Ministry of National Security to provide assistance with security services, and they have been doing yeoman service to the Ministry of Health and the national community. They provide 24-hour, around-the-clock surveillance at our step-down facilities and quarantine facilities. So Defense Force has been doing it throughout. If you have those instances, if you could pass it to us so we can send onwards to national security to at least let them look into those instances. It will be greatly assist the way we have persons in quarantine and step down.
Thank you, and we encourage the public, please, to work with us and to help us do what we can to stop the spread of COVID-19. And we go to IETV, please. Is IETV on and ready? And as we wait on IETV, we do have one question that we get quite often from the public, and I'll go to IETV next after this. A simple question: what are active cases? They see that in our releases, and that's something that's discussed. What are active cases, and why is that number important?
Okay, so active cases are basically the total number of cases of persons who are positive for COVID-19, who have not met either the discharge criteria or the criteria for the end of their quarantine period or isolation period. So those would include all the cases that we have who are positive at home isolated patients, together with all the cases that we have at hospital. So those are a total number of active cases in the country. We keep a very close eye on it, sometimes to see how, if it goes down, it means that the number of discharges exceed the number of new cases. It gives us a good idea of the caseload at any given point in time.
Thank you very much, CMO. And IETV, we're ready for you now. Just check on your volume. Maybe the mic is muted because we're not hearing you. I see that you are asking a question. Just check on your settings, and let's make sure. Or everything's fine on your end. Okay, I think we'd have to get that question sent in to us at this point, and we will await the question that's sent in to us. One other question that we are getting from the public: what are some things that persons can do to keep motivated? Dr. St. Bernard, one of the reporters earlier talked about the frustration, and we're at our wits' end. What are some things that you are doing, Dr. St. Bernard, that you think that people on the street can do to keep themselves motivated and to keep following the new normal guidelines?
Hi. So in terms of continuing to survive the pandemic, I know that, we talk about things like burnout among healthcare workers. And just generally, I guess for the public, continuing to follow every guideline can feel wearisome. When is this thing going to actually end? And I know that one of the things that we talk about is something called self-care, where you literally have to take the time to do something for yourself. Whether it's, for those of us who are not on call and have to answer our phone literally, every night, every day, you need to have a time for turning off your cell phone, on a proper bedtime so that you go to bed at a time where you can get adequate sleep, continue to hydrate well, drink your water, and if you can avoid sugary drinks, eating healthy, not just buying, food or snacks. I heard someone mention Dixie biscuits earlier today. But, just generally taking care of yourself, even in the midst of the, I'm so tired of wearing this mask. Even family time. Now that we're in a lockdown of some sorts and still having to restrict movement, we need to look at the positive side, which is more time with family. And hopefully, we do get along and we do like being with our family members. So for those of us homeschooling the kids, look at it as an opportunity, to get to have a sneak peek into what they're doing, not being discouraged. And if it is, you need to do movie time, but what we do not encourage would be, the negative behaviors to manage the pandemic, such as, alcohol and substance abuse of any sort, So reaching out to each other, still, even though we talk about physical distancing, we don't need to necessarily social distance. And what I mean by that is we don't want to socially distance to the point where you don't video chat, with granny, even though you can't go to visit. We can still communicate via telephone, via video chats, and continue to connect as much as possible. Even when we're having meetings, we would, do video. So when I meet with my staff, even though it's distal, I would meet with them via video so they see the face. So these are just some of my tips for that public question. Thank you.
Thank you very much, Dr. St. Bernard. And we go now to TV6.
Hi, good morning.
Good morning, we're hearing you.
Hi.
Good morning, we're hearing you. You can go ahead and ask the question,
okay,
Ms.
I'm now
Cutting.
hearing.
Great.
Yes. Could the ministry see through its contact tracing exercises, where are some of the places where we are seeing persons contracting the virus now? And I asked that because I was looking at an interview out of the UK, and they were presenting information that the vast majority of their cases are coming from the workplace and the schools, not bars and pubs and these types of things. That was a very, very small percentage. So I want to know where our cases are coming from, and also how does this data influence our local strategy moving forward?
Okay, so what we have noted, it changes based on your phase, all right? So right now, as you know, the schools are closed, so we obviously can't get cases from schools, although schools are known to be high-risk settings for transmission of this virus. We find that, of course, most of the cases that we're getting are linked to the workplace because we have the workforce being out to have, so most of the cases, I would say, as you indicated with other countries, are coming from the workplace. We have some transmission occurring outside of that, which has not been necessarily linked to one source or the next, but the majority of it will be linked to workplace activity to some extent, at least during these last couple of weeks or last month or so.
Thank you very much, CMO. And we try one more time to go to IETV. We hope we can hear you this time around. IETV?
Hi, good day, everyone. Are you all hearing me now?
Perfect, thank you.
Okay, great. Sorry about that before. So I have two quick questions, one for the CMO. CMO, I would have observed personally for myself, I passed by the Eric Williams Medical Sciences Complex, and I know that you all have tents outside for persons to wait before they are called inside for their clinic. What I observed was a large number of persons standing, sitting, gathering around. They were not socially distancing, waiting for their applications or whatever to be processed to go into the clinics. Is there any update on the situation with clinics? Clinics being organized accordingly to the numbers? Can you just give us a little update on that, if anything is going to be sorted out, so persons wouldn't have to wait and gather and not socially distance properly when they have to go to the clinics? And my second question, a quick question, is for Dr. Hamid. Has telemedicine been successful within the older population, seeing that they are more inclined to go towards traditional medicine and traditional doctors? Has it been a success for the elderly as well? Thank you.
So I will begin, and then Dr. Hamid will answer his part. But basically what we have done in North Central through the CEO of that particular region, so the Chief Executive Officer, Mr. Thomas, is responsible for the activities at North Central, and I will inquire from him as to what is happening in recent times. But I have noted they have set up, the way they have set up their clinics is to have that open air sort of tents at the front of the building so that they can decrease interaction, decrease waiting time. And Dr. Hamid's telemedicine initiative, which is at North Central, is aimed as one measure to decrease persons having to wait or congregate outside the hospitals for any particular clinic. So Dr. Hamid can go into a little more detail.
All right, thank you so much for the question. And that's one of the things, the biggest success story actually, is the appreciation, especially for the older persons who can't come out of their houses or depend on other persons to get transport. They have been extremely appreciative of the telemedicine. And even self that they can't speak to the doctor or they don't have a phone, they have a relative who would be contacted as well. And we have been counseling the relatives as well to take care of their older persons at home. So it is very, very successful in terms of our elderly population. On a daily basis, we get commendations from patients saying that they didn't know something so revolutionary could have existed in Trinidad and Tobago. So it's something that we really want to move forward with as a national program because of the impact it could possibly have. I hope that answers your question.
Thank you, Dr. Hamid, CMO, Dr. St. Bernard, and everyone behind the scenes who work so hard to make sure that these press conferences go well. We are at the end of our press conference today, and of course the media. We are at the end of the press conference today. We shared with you quite a range of information, new advancements, simple things that you can do. But if you leave with one thing today, please remember, wear your mask. Take care.